going in the discussion of drug, we will first discuss about the general neurophysiology. So hypothalamus. So neurons within the hypothalamus will decide the activity level of your sympathetic nervous system and parasympathetic nervous system. Okay, hypothalamic neurons decide, make balance between the sympathetic nervous system and parasympathetic nervous system function. It is a rough diagram of the hypothalamus. So anteromedial area of hypothalamus basically decide the activity of parasympathetic nervous system, and your posterolateral area of hypothalamus decide the activity of sympathetic nervous system. Okay, so this is the basic about the control of the sympathetic and parasympathetic area. Clear? Now we will take an example. Suppose if a dog start barking in front of a boy, then what happens with that boy? That point we are going to discuss. So first, the information from visual cortex. Okay, by seeing that dog, by hearing the barking, information from auditory cortex, and if that guy has past experience with the dog, okay, so from cerebral cortex. From these regions, message goes to your limbic cortex. Okay, and through limbic cortex give negative feedback. Negative, from here nerve fibers arises which will innervate the anteromedial portion of hypothalamus. Okay, and give neurons which will excite nerves which are present in posterolateral portion of hypothalamus. Clear? So message comes to limbic cortex. These are the stressful information which is reaching to the limbic cortex, because after seeing the dog, stress has created in that guy. So stressful information from these three areas, okay, these three areas is reaching to limbic cortex, and from limbic cortex nerves are going to inhibit anteromedial portion of the hypothalamus and going to excite the nerves of the posterolateral portion of the hypothalamus. Clear? And from here nerves will rise which will excite your polyneuronal descending pathway, PDP. Okay, polyneuronal descending pathway which is descending from hypothalamus. Okay, excite these neurons. These neurons will increase your sympathetic flow. Okay, sympathetic discharge will increase due to these nerves, activation of these nerves. Clear? This is example. Suppose from posterolateral portion of hypothalamus, these nerves are coming. Okay, and these nerves are making synapse with your preganglionic sympathetic nerve. This is your spinal cord cross section, and this is your preganglionic sympathetic nerve. So this polyneuronal descending pathway coming from hypothalamus, posterolateral portion of hypothalamus, and making synapse with preganglionic sympathetic nerve. Preganglionic sympathetic nerve coming here, making synapse with the postganglionic sympathetic nerve. Okay, and it is going to the target tissue. Clear? And at target tissue, this postganglionic sympathetic nerve will release norepinephrine. Clear? And this preganglionic neuron will release ACH. This is very, very important. This is releasing ACH and this is releasing norepinephrine. Clear? Also, nerves from posterolateral portion of the hypothalamus, that is which is coming to polyneuronal descending pathway. Polyneuronal descending pathway also gives nerves to adrenal medulla. Okay, so this is the nerve going to adrenal medulla. It will release acetylcholine here, and acetylcholine will act on the tissues of the adrenal medulla which will release epinephrine. Clear? So ACH acts on adrenal medulla tissue. It will release epinephrine mainly. Okay, through circulation it will bind to its receptors. Epinephrine will bind to its receptor. So basically activation of posterolateral portion of hypothalamus is releasing epinephrine. Okay, and norepinephrine. Here it is releasing norepinephrine, and adrenal medulla is releasing your epinephrine. Clear? Now moving to the next slide. Now, so this was the basic which we have discussed in our previous slide. This was the basic of the adrenal sympathetic nervous system activity. Now, neurotransmitter of low molecular weight is generally synthesized in your nerve terminal. Okay, neurotransmitter such as norepinephrine. Norepinephines are the low molecular weight neurotransmitter which will generally synthesize in nerve terminals. Some neurotransmitter also synthesize in your cytone, but it is synthesized in your nerve terminal. How norepinephrine is synthesized? That is one of the most important point for your pharmacology, because several drugs will target several enzymes involved in the synthesis of norepinephrine. So first we will discuss the synthesis of norepinephrine. Clear? So starting with the discussion of your norepinephrine. So please see that. So from intestine, okay, from intestine your tyrosine, Okay, from intestine, tyrosine is absorbed from intestine and transported to neuron. Okay, this is transporter for tyrosine. So tyrosine is transported through its specific transporter to the nerve cell. Now tyrosine is acted upon by tyrosine hydroxylase and it will lead to the formation of DOPA. Clear? Now DOPA, after decarboxylation, DOPA undergo decarboxylation to form dopamine. So one COH is present extra in this DOPA, so that COH, that carboxyl group, is released in the form of CO2 and leading to the formation of dopamine. And here the enzyme is DOPA decarboxylase. Clear? And after formation of dopamine, dopamine is packed into vesicle. Dopamine goes to vesicle by a specific dopamine transporter. Clear? And after going inside the vesicle, dopamine will be converted into norepinephrine. Clear? By dopamine beta hydroxylase. The enzyme is dopamine beta hydroxylase, means one OH is again added to dopamine to form norepinephrine. Okay. Now here it is mitochondria, and associated with mitochondria one enzyme is present that is known as monoamine oxidase. What is the name of enzyme? Monoamine oxidase. And this monoamine oxidase generally catalyzes the amine types of compounds. I have written here. First here, dopamine, norepinephrine and epinephrine are all monoamine derivatives because all has amine group. Okay, so it can be destroyed by monoamine oxidase enzyme. Clear? So this compound can be destroyed by monoamine oxidase enzyme. So as dopamine is formed, it is quickly transported into vesicle. This is the reason why dopamine is transported to vesicle. Clear? Now norepinephrine, which is inside vesicle, is combined with your certain proteins. Okay, that is known as chromogenin. Certain proteins, one of the protein is chromogenin, to decrease osmotic potential. Clear? This norepinephrine which is formed, it will combine to proteins, group of proteins. One of the protein is chromogenin. Okay, why? See, we know that is osmotic potential. I am changing the pen. Okay, so please see. You know osmotic potential. Osmotic potential is a colligative property, so it is directly proportional to number of solute particle. Okay, if number of solute particle decreases, osmotic potential will decrease. If number of solute particle increases, osmotic potential will increase. Now suppose 4 norepinephrine are free, so it is contributing more osmotic potential. But if protein combines all these norepinephrine with it, then it is forming complex which is counted as one particle. Okay, osmotic potential is directly proportional to number of particles, and now it is, after making complex, it is forming only one particle, so osmotic potential is decreased. Clear? So norepinephrine in vesicle combined with different type of proteins to decrease osmotic potential. Clear? So that water will not enter inside it and does not burst that vesicle. Now moving to the next slide. Again, so now see here, norepinephrine is formed and stored in vesicle, and now norepinephrine containing vesicle will come and fuse with your presynaptic membrane. Okay, now suppose this is the diagram which I am showing. This is the presynaptic membrane and this is the vesicle. Now these vesicles contain a special protein that is known as synaptobrevin, which is present on vesicle, and the presynaptic membrane which is showing in this is the presynaptic membrane. This connect synaptotaxin that is present on the presynaptic membrane. Okay, and this synaptobrevin come and combine with this synaptotaxin. Okay, and fuse with it, and then vesicle will release its content, that is norepinephrine. Clear? Now one more important point here. One more important point in previous diagram. You see here. Next diagram. See here. First, vesicle exocytosis means release of norepinephrine by the fusion of vesicle with presynaptic membrane needs entry of calcium inside the nerve terminal. Why calcium is entering? I am showing here. Here see. Here I will change the pen so that you can easily appreciate. Now see, these are the two. One is this and one is this. Okay, these are the two structure which is covering the binding site of the synaptobrevin on synaptotaxin. So it must be separated so that this can bind to this place. Okay, so when once calcium enters the neuron due to depolarizing wave, once depolarization occurs, calcium will enter inside the cell, and this calcium will bind to these two endings. When the calcium will bind to these two endings, and then the positive charge, both are positive, so they will repel each other. Okay, and it's lead to activation of synaptotaxin. The synaptotaxin is activated, and the binding site of synaptobrevin on synaptotaxin is opened up. Clear? Then vesicular fusion with membrane will occur, which will lead to exocytosis of norepinephrine. So this is the whole mechanism how norepinephrine is synthesized and how norepinephrine is released into synapse. Clear? Now this is the synthesis. Now we will discuss about the adrenergic receptors. So there are basically two types of receptor, alpha and beta. In alpha there are two types of receptor, alpha 1 and alpha 2, and in beta, beta 1 and beta 2. In some cases beta 3 is also fine. Okay, we will discuss in detail later on. Now this alpha 2 very important. This alpha 2 is most important among this, because this alpha 2 is generally present on presynaptic membrane. Okay, it is itself present on the nerve terminal, that is presynaptic membrane. Okay, this alpha 2 receptor is present on the presynaptic membrane, while alpha 1, beta 1 and beta 2, these are present on presynaptic membrane, postsynaptic membrane. Alpha 1, beta 1 and beta 2 is present on postsynaptic membrane, while alpha 2 is present on presynaptic membrane. This is the very most important point. Clear? So I am showing this nerve terminal membrane. This is a presynaptic membrane. Presynaptic membrane has alpha 2 receptor. Clear? While target tissues may have alpha 1, beta 1 and beta 2 receptor. This norepinephrine can bind to both, all these four, alpha 2, maybe alpha 1, beta 1, beta 2. Okay, these are all the receptors of norepinephrine. So we are discussing in adrenergic receptors. Clear? Now moving to the next slide. Now starting with the what will happen to norepinephrine which is released in the synapse. What will happen to norepinephrine which is released into synapse? Before going to this, we will first discuss about alpha 2 receptor. Okay, which is present on the presynaptic membrane. So if norepinephrine is released into synapse, this can bind to the alpha 2 receptor. Okay, and alpha 2 receptor is associated with G coupled protein receptor, which is of G inhibitory type. Clear? So once G inhibitory type of G receptor GPCR will activate, then CAMP will decrease, amount of CAMP will decrease because adenylate cyclase will get inactive. So this will decrease, then protein kinase activation will decrease, then activation of enzymes for synthesis of norepinephrine will decrease, such as tyrosine hydroxylase, dopa decarboxylase. Those are the enzymes which are responsible for norepinephrine synthesis. Those activity will get decreased, so ultimately decreasing norepinephrine. One more, it will lead to the opening of K+ channel. So K+ efflux started. If K+ efflux start, then it will lead to the hyperpolarization. Then calcium will not enter inside it, and if calcium will not enter inside this, then synaptotaxin will not get activated. Means norepinephrine, if norepinephrine will bind to alpha 2, then it is inhibiting the release of norepinephrine. It is inhibiting the synthesis of norepinephrine. Clear? So this is known as auto-inhibitory loop. Means this nerve is itself inhibiting its own functions. Clear? This is known as auto-inhibitory loop. Now we will discuss what will happen to norepinephrine which is released in synapse. So norepinephrine, mind it, we discuss acetylcholine will be degraded by acetylcholine esterase, but norepinephrine will not be degraded as acetylcholine. Very important point. Okay. Now norepinephrine will be reuptaken by your presynaptic membrane. Okay, norepinephrine will be reuptaken, it will be not destroyed by, it will be reuptaken by the presynaptic membrane transporter. Okay, and those transporter which are present for reuptake is generally sodium coupled transporter. Clear? But yet some of norepinephrine will be destroyed in synapse by one enzyme that is known as catecholamine O-methyl transferase. The enzyme is catecholamine O-methyl transferase. What it will do? It will remove OH group and add CS3 group. Okay, it will remove OH group from the norepinephrine and it will add CS3 group in that place. So the functions of the norepinephrine is getting lost. So some amount of norepinephrine will be destroyed in synapse by the catecholamine or methyl transferase, but maximum part is reuptaken. Very small amount will be diffused in the blood. Okay, so these are the fate of the norepinephrine which is released in the synapse. Moving to the next slide. So this slide is somewhat very bad, but look for this. One important point is there. So the membrane of vesicles has another amine pump which is known as VMAT. VMAT2 means vesicular monoamine transporter 2. This is present on the vesicles in which norepinephrine was packed. Okay, and it will which will transport your norepinephrine, okay, from cytoplasm to interior of the storage vesicle. Clear? Norepinephrine is reuptaken by sodium coupled receptor. So norepinephrine has come in your cytoplasm, and from cytoplasm it has to be gone into vesicle. So going to vesicle is by transporter, that is VMAT2, vesicular monoamine transporter 2. Okay, the VMAT2 transport monoamines by exchanging with H+ ions. Clear? Now moving to the next slide. So these were the introduction part of the pharmacology, general neurophysiology of the pharmacology. Now we will discuss some drugs which will target the process of the synthesis and the secretion of the norepinephrine. So the first drug is methyl tyrosine. Okay, it is blocking the synthesis of neurotransmitter, that is norepinephrine. Clear? So if methyl tyrosine is uptaken instead of tyrosine, because methyl tyrosine both can go by tyrosine transporter. So if methyl tyrosine is given into a patient, then methyl transport will enter the presynaptic membrane, means nerve terminal. Okay, and it binds with tyrosine hydroxylase, which was the first enzyme, reducing its activity. Means methyl tyrosinase binds with tyrosine hydroxylase and it will reduce its activity. Okay, so the action of methyl tyrosine is blocking the synthesis of neurotransmitter, because if tyrosine hydroxylase will not free, then it is not able to convert your tyrosine into dopa. Clear? The next drug which is most important is reserpine. Okay, it inhibits the transport of dopamine inside the vesicle. It inhibits the transporter which transport dopamine inside the vesicle. So this is dopamine which is transported into vesicle is inhibited by your reserpine. As well as when norepinephrine is reuptaken and transported by VMAT transporter inside the vesicle, that is also inhibited. Okay, so both reuptaken of the norepinephrine as well as dopamine transport inside the vesicle, both are inhibited by reserpine. Clear? So it is blocking storage of neurotransmitter. Now the next drug is gunadril and bretylium. Brother name gunadril and bretylium. So it decreases vesicular fusion with presynaptic membrane. Okay, so it will not allow release of neurotransmitter into the synapse. Gunadril and bretylium. So three drugs. First one is methyl tyrosine, then reserpine, then gunadril and bretylium. Okay, the next drug is your alpha methyl dopa. It enters into neuron and mimic the place of dopa. Okay, it is mimicking the place of dopa. It is converted into alpha methyl norepinephrine and it will release into synapse, but it will not bind to the receptor on the postsynaptic membrane, because the receptors are very, very sensitive. It can only bind norepinephrine. It will not bind alpha methyl norepinephrine. But this alpha methyl dopa cheat all the enzymes. Okay, alpha methyl dopa is converted into norepinephrine, alpha methyl norepinephrine. Norepinephrine is also released in synapse, but the final step, that is the binding of alpha methyl norepinephrine to receptor, is not going to be held there. Okay, so alpha methyl dopa drug can also inhibit the action of your sympathetic nervous system. Okay, so these are the basic drugs which is targeting the formation of the norepinephrine, also release of the norepinephrine. Now we will discuss receptor-based drugs. Okay, so first we will general description. Agonist that binds to receptor and stimulate the action. Antagonist only binds to the receptor, having no ability of stimulating. Okay, whereas partial agonist means it will bind and having partial ability to stimulate. This is known as partial agonist. Clear? And in next video we will discuss in detail about the receptor based drug. So thank you for watching.